Hello and a warm welcome to our look ahead to what the papers will be bringing us tomorrow. We are joined by the chief leader writer of The Observer, Sonia Sodha, and the deputy political editor of the Daily Express, Sam Lister, and we'll be going through the front pages in just a moment. But first of all, let's have a look at the front pages that we have already. We're going to start with the Metro because the paper is claiming that a three-tier system of local restrictions is going to be announced on Monday. Pubs, bars and restaurants are facing shutdown and families could be banned from meeting each other in each other's homes. The Mirror says that many of the areas likely to be given increased restrictions are in the north of England. The Guardian reports that scientists advising the UK governments believe that the new restrictions don't go far enough. They think that a so-called circuit breaker was needed weeks ago. And on the front page of The Eye, a stark warning from England's chief medical officer who says that in 3 weeks' time, intensive care cases in the north of England could pass April's peak. Elsewhere, the Daily Telegraph reports on a new campaign to ensure that people with non-COVID related sickness get the treatment that they need at hospitals and GP surgeries. And it comes as the Daily Mail reports on the impact of lockdown on patients earlier this year, with new figures showing that more than 110,000 people have now been waiting for a year for medical treatment. And let's turn our attention to a couple of the international front pages. Le Figaro reports that several large French cities, including Lyon, Lille, Saint-Étienne and Grenoble, are being placed on a maximum COVID-19 alert, while the Japan Times says that debate persists on whether or not to hold the Tokyo Olympics next year, with some arguing that it will help to revive the economy, but of course others worrying that the pandemic will not be over by then. So as always, well, once again, the coronavirus and everything that comes with it dominating the pages and the international pages. Sonia, Sam, really good to have you both on as always. Thanks for giving up your time tonight. We're going to start with the Metro, which is looking at this three-tier system, Sonia, that we're potentially going to have announced on Monday at the beginning of next week, but still a little bit of confusion. We don't know exactly the details, a lot of speculation as to how these three tiers will look, but ideally it will be a simplification of the kind of patchwork of local restrictions that we have at the moment.
Yes, so the government's faced a lot of criticism for that sort of hodgepodge of different types of restrictions in different local areas. People have said, quite fairly, I think, that it's very confusing and that in some areas where you've got lower rates of infection than in other areas, you still seem to have tighter restrictions. So I think people feel that there's quite a lot of inconsistency across different areas of the UK. And this idea of a sort of traffic light system with green, amber and red, so sort of three tiers, is hopefully something that might help simplify the system a bit. I mean, obviously, it's a tightrope that the government's got to walk because infection rates in one local area may be more to do with one thing, for example, universities and student halls. In another area, it may to do with, household mixing. So you can see why the government does kind of maybe need to fine-tune restrictions in particular areas, but you can also see how that's incredibly confusing for members of the public. So I think it's about trying to find a trade-off between these two things. But I think it still remains quite, we're getting briefing that it is going to be a three-tier level of restriction. We don't know. It's very hard to work out actually from what's in the papers exactly what is going to kick in at what level, which areas this is going to apply to. But I think the biggest concern at the moment is really in particular in areas of the north. You've got local leaders, some of the big metro mayors say they've had absolutely no advanced sighting of these plans. They don't know what it's going to be, and they're extremely concerned that at the moment the government has made no commitment whatsoever in terms of support for local and regional economies. So if pubs and restaurants have to shut, what's going to happen to people's jobs? So we've got mayors really pushing on that.
And one fascinating insight the Daily Telegraph has picked up on is the data. This idea, of course, that pubs, restaurants need to shut their doors by 10 o'clock. Sam, the Telegraph is suggesting that the intel, the data on which this decision to shut those doors at 10 was cobbled together. Just talk us through what they're basing this on.
Yeah, there's been a briefing for MPs in the regions that are likely to be affected, but they came out of it, I think, more disgruntled than perhaps they went into it, because the government are saying that there is evidence to suggest that the hospitality sector is partly to blame for the rising cases. But when you actually try and push for the details of that, it's not forthcoming. And when we have a briefing with Number 10 every day, and when we were pushing for figures earlier, we were told that there is evidence, but they're not ready to publish it yet. And that does make you slightly concerned about quite how nailed down this study is, how hard this research has been tested and put, because a lot of pubs and hospitality businesses are saying, well, actually, we're really COVID secure. We've gone to great lengths to make sure our customers are protected, and we've not had reports of a spike in cases linked to our business. So I think everyone's a bit baffled as to where this data actually has come from and how reliable it is.
Indeed, and we were interviewing Alex Norris MP, the MP who for Nottingham North, and he was one of those who was at that briefing. And yet, as you say, there was a lot of still. Put it this way, he wasn't convinced by the science that was put forward by during that briefing. Of course, the consequences absolutely huge, and that's certainly something that the Daily Mail has picked up on. Sonia, ultimately, it affects all of us when it comes to the patients' waiting lists. 110,000 patients now waiting over a year for treatment. It's a staggering amount.
It is a staggering figure, and it's up 100-fold from what it was in February before the pandemic started. In many ways, this was an inevitable consequence of that dreadful first wave of the pandemic that we saw. Hospitals and intensive care beds were in the main given over to patients suffering from COVID. Very acute condition. It's kind of very hard to see what else the NHS could have done if it was going to save lives. But obviously there are consequences for the long-term health of the nation in terms of other conditions. And I think the thing that is reassuring is that, the Daily Mail here is kind of sort of trying to present it as a bit of a trade-off. So we took the choice to save the lives of COVID patients, and therefore we put lots of other lives at risk. It's not quite as simple as that either or, because of course, if you don't sort of take restrictions early enough, hospitals end up getting overrun, ICUs end up getting overrun with COVID patients, and it just kind of crowds everything else out. So going into the autumn, where we're already seeing a second wave, I think the absolutely key thing is to have the right level of restrictions done in a timely enough manner so that you don't see the situation developing again in the NHS. And there are people working in the NHS very hard, I think, to ensure that people are absolutely determined that elective care is not going to get put to one side in the way that was necessitated during the first wave of the pandemic. But the only way to do that is to try and keep this what's going on in check. And the NHS certainly is making plans around COVID designated hospitals and non-COVID designated hospitals, so that there will be hospitals which you have to have had a negative COVID test to go into to receive treatment, and therefore if you're, for example, getting cancer treatment and your immune system is suppressed, it'll be much safer for you to go into those hospitals. So we have to hope, I think, that this is something that, given how much more we know, given that we've had more warning about the second wave, this is something that the NHS will be able to manage better this time.
Indeed, and it's the Daily Telegraph also just picking up on this idea, Sam, that this campaign will try and assure patients that they're not a burden, because of course we've been so concerned about not overburdening the NHS that now people are feeling that they shouldn't go in and get treatment, so they're trying to overcome that.
Yeah, I think this is, essentially most people are trying to be good citizens during this pandemic, and I think this is a reflection of that, because actually people are so conscious of not being a burden on the NHS. We've seen all the messages about protecting the NHS, and people have really taken that to heart. But the problem is, it does have this flip side of people failing to receive treatment for other potentially fatal illnesses and actually more mundane things. But it is a reflection of the fact that people are just trying to do their best to help the country through this. I think there is a flip side as well, though. I think there are still some GPs that do seem to be keeping their doors closed to face-to-face appointments with some people. And then there's a big backlog for hospitals, consultants, patients who perhaps would have been seen quite quickly. That there's such a backlog in hospital appointments that they're facing delays. So there's two sides to it, really. But yeah, there seems to be a campaign being launched, Help Us to Help You. And that is to try and say to people, look, you can go and get treatment. You really must. Don't stay at home.
We'll come back to COVID in a moment, and we'll have a look at what's happening internationally when it comes to the coronavirus, how other countries are dealing with it. But just the FT looking at Donald Trump. Did either of you stay up for the Kamala Harris and Mike Pence debate?
I'm afraid not.
No, it was past my bedtime.
Well, I have to say I did stay up. I fell asleep before the fly turned up. But the Financial Times is looking at this idea that this virtual debate that had been suggested, because of course with Donald Trump having tested positive for COVID, it's best to have it virtually. But then Mr. Trump said he's boycotting it. Sonia, it's quite a situation that they've got in the US, bearing in mind that we are under a month now to the actual election.
Yeah, and Trump has tested positive for COVID-19. He's got the disease. He's been ill with it in hospital. He's, by all accounts, he's not made a full recovery yet. So I think this is President Trump just trying to wriggle out of another debate, because we know the first debate that he had with Biden, all of the polls, all of the snap polls suggested that Biden sort of trounced Trump rather in that debate. He didn't have a good debate, Trump, and I think he will think that it's in his own interests not to face Biden again. The Presidential Debates Commission, it's a bipartisan commission. Of course it's going to recommend a virtual debate. Trump actually has COVID. He can't be live in a studio. Can you imagine how many lives he would be putting at risk? I mean, he already has put lives at risk by doing a presidential drive-by and taking off his mask when he was being filmed. The idea that he would be able to do a debate in a studio is completely and utterly crazy. But this seems to have given him the excuse that he may think he needs to say, well, sorry, I'm not going to agree to do this virtually. But I mean, of course, it should go ahead. Of course, the American public, I think the first debate was rather unedifying. I'm sure most people will agree who stayed up to watch it. But the American public do deserve to see a debate between the two presidential candidates. And I think it just shows how cowardly Trump is, and the fact that he doesn't want to face Biden by saying that he won't agree to do it virtually.
Sam, do you think there needs to be any more, because there meant to be two more debates, do you think they're even needed, given how many people have already made up their mind, how many people have already voted?
Well, you do wonder. I mean, as Sonia mentioned, the first debate was just so awful to watch. I mean, it was virtually unwatchable, wasn't it? It was just so excruciating. And you do think, do the poor citizens of the USA really need to endure that anymore? But really, it is their democratic right to see these things. These have been, obviously in train for decades in America. It is part of their presidential electoral cycle. I mean, it's quite interesting, isn't it? Obviously, Trump is way behind in the polls, but we've seen where that's led before. But we certainly saw from the debates over here in the UK that it was always the incumbent who had most to lose from the debates and was most fearful about doing them. So you can see perhaps why he's reluctant, and if he's got an excuse, he's planning to use it.
Indeed. Well, we should just watch and wait what comes out of Washington, because it's quite been an extraordinary week so far. And let's go back to coronavirus. Financial Times looking at the situation in Europe. Sonia, the figures are just going absolutely high. We don't have much time left, but just talk us through what the FT is saying.
Yeah, so it's just pointing to what's going on in Europe. If you look at countries like France and Spain, they are definitely ahead of the UK in terms of the second wave. We've seen much tougher restrictions being introduced in cities like Madrid, Paris, other cities across France, ahead, much tougher than what we've seen in the UK. Really worrying signs around hospital beds as well. In Paris, I think it's about 40% of acute care beds currently occupied by COVID patients. So I think it's a real sign of what we could be to see in the UK if we don't get a grip on this ASAP.
And yeah, Le Figaro as well, Sam, talking about the situation in France.
Yes. Sonia just touched on there. There are these 4 more cities that are facing hospitality bans, and the hospitals have been put on alert for a big surge in patients. I mean, it is quite interesting just to see how, because when you're in the UK, you do become obviously completely obsessed with what's happening here, and it's just interesting to see how different countries have approached it and are still suffering this second wave, particularly Germany, which obviously was doing particularly well, and now is facing this real spike in cases.
And just finally, The Telegraph, I was desperate to get this one in. Wisdom teeth. This is an extraordinary... Sonia, what is going on? Wisdom teeth are no more.
So apparently it's evolution in action. Babies now seem to be it's more common for them to be born without wisdom teeth. And I guess, people who've had their wisdom teeth taken out will know that they're not necessarily things that we need in this one day and age. And scientists think that this is the sort of very gradual process of evolution, us losing things that perhaps we don't need in action.
And it's something to do with, Sam, I haven't read this properly, but shorter faces, extra bones, we're all changing anatomically.
Well, certainly I had my wisdom teeth out. I don't know about you two, but it was if they've managed to develop, if the evolution's developing to wipe them out, I'm certainly all for that. It's quite painful.
Yeah, it's given that it's now with the situation with getting dentist appointments, but it just goes to show the scientists. We've been seeing so many fantastic Nobel prizes in science that the scientists are doing their work here, Sonia. Yes,
that's right, and it's kind of. I suppose it's nice to have some science news on the front page that isn't COVID.
Yeah, indeed. Well, look, we're going to have much longer to discuss the papers in the next edition of the BBC Papers. So, as always, it's really good to get your opinions through this quick look through. But Sonia and Sam, don't go away. We'll make sure that you get some more of the editions that come into the BBC newsroom. Great to see you both. And yes, when it comes to wisdom teeth, I'm very pleased, quite frankly, and I'm sure lots and lots of other people are too, because it was one of the most awful experiences that I've had, along with giving birth. Thank you so much. I'm sure people don't need to know that. So yeah, like I say, we'll be back very shortly with the next edition of the papers. And if you'd like to chat to us via social media, the hashtag is BBC Papers.